My training is in orthopedic surgery, and I did an additional year of fellowship training at Mass General Hospital in sports medicine. I was an athlete growing up, and really interested me as a profession. I like taking care of athletes, a motivated population. They're motivated, they want to get back to sport, and easy to take care of. So it's a fun practice for me, and I've been doing it for 25 years. Everyone identifies themselves as an athlete. I have 7-year-old patients who come in, and there's a form to fill out, are you an athlete? And it's intended for the Bruins patients or the high school kids or the college kids coming in. But the 80-year-old checks off, yes, I'm an athlete. And you look back, and they were quite the athlete back in high school and college. So I think once you have that identity, you always keep it. And that's fun to see. We have the young kids coming in, the adolescents and the teenagers from high school, taking care of the college kids and the professional athletes. So it's a fun practice to have a little bit of all that. We tell people all the time, it's not just about getting back to sport. We're trying to, number one, be safe for the athlete. What's best for them in the short term and the long term. People make different decisions, and everyone, a lot of the younger athletes will make decisions that maybe aren't health conscious, and so we need to help them do that and try to make decisions for them, or at least help them, go the right direction. In terms of my partners, I don't have any hesitation to refer to any one of them, from pediatric to geriatric, spine, hand, sports, shoulder. We cover it all, and we do it at a top level. I think I think of us as being the best in the region and as good as anybody in the country. We do great research. I think we're trying to push things further in so many different domains, and it's just an exciting place to be.